The South Korean government today has lifted mandatory mask regulations in most indoor facilities, with the exceptions of medical institutions, pharmacies, high-risk facilities, and public transport. This action has been taken 27 months after the mask mandate was implemented in October 2020. Wearing a mask indoors is now a recommendation rather than an obligation. The number of confirmed cases recorded on January 30 was the lowest in about 7 months since July 4th last year. The government planned to ease the restrictions if 2 of their 4 criteria were met: a downward trend in new infections, a decrease in critically ill cases and deaths, strong medical response capabilities, and a high vaccination rate among high-risk groups. The South Korean Prime Minister Han Duck-soo announced that 3 of the 4 criteria have been met, with the exception of high vaccination rate among high-risk groups. The Korea Disease Control and Prevention Agency has revealed that masks are still required in hospitals or pharmacies, even if they are located inside a facility that no longer needs a mask. Furthermore, schools and sports facilities are able to operate autonomously, but masks remain compulsory for such facilities that are inside medical institutions. People who show symptoms of COVID-19 or have been in contact with a confirmed case should also keep their masks on. The Ministry of National Defense has also announced today that they will lift the indoor mask mandate in the military, but wearing one is still recommended when visiting high-risk facilities to prevent loss of military strength. The KDCA strongly recommends wearing a mask for your own benefit to protect yourself and the high-risk groups despite the lifting of the mask mandate. They announced that only the legal liabilities have been lifted, which doesn't necessarily mean that masks are no longer required.